Hi guys, welcome back. Yet another day, yet another problem, and we have a solution. Now, most of the medical students are not getting enough opportunities to present cases, to take history, to interact with patients because patient load भी कम है, time भी कम है और फिर entrance exam के लिए भी prepare करना है. And unfortunately, we are lacking the skill of history taking. And I keep telling you, each case that we have successfully diagnosed in clinical practice, they were diagnosed not because some lab report said this particular patient has this particular disease. Most of them were diagnosed because we could take a good history, we could make a provisional diagnosis from the history, and we just took the support from the lab to arrive at the confirmed diagnosis. And if you are not good at taking history, then you have to do n number of investigations, add a cost burden to the patient, फिर गालियां भी सुनो, and then eventually you will end up with some diagnosis where again you will lack the confidence कि हाँ ये diagnosis सही है नहीं. LFT report भी abnormal है, RFT report भी abnormal है, CKD कहूँ या CLD कहूँ, you are totally lost. But if you have taken the history, you will not be in that confusion. If you are struggling to find a patient where you can collect the history or interact, you can substitute the patient with an AI tool, and that can act as a patient and you can interact with AI tools. So today, let's take the example of Gemini, how Gemini can play the role of a patient and how you can take the history from the Gemini itself, not the real patient. And let's see how we can practice. So right now, the Gemini is open with me. I will give the command, you can follow the same command or my team will pin the command in one of the comments and you can use that command to reach out to Gemini. Hey Gemini, I want you to play the role of a patient coming to emergency room with chest pain, and I will be playing the role of a doctor interacting with you and examining you in the emergency room. Among all possible differential diagnoses of chest pain, you can play the role of any of them, ranging from GARD to esophagitis to the acute MI. Once you are ready, let me know.
Doctor, I'm having this terribly tight, crushing pain in my chest and it feels like it's radiating up to my jaw and down my left arm. I'm also feeling really short of breath and sweating profusely. Please note that this roleplay scenario is not medical advice or diagnosis. If you are experiencing chest pain, please seek immediate medical care or contact a healthcare professional.
Okay, so can you tell me whether the chest pain started when you were at rest or did it start on some kind of physical activity or exertion?
It actually started while I was just sitting on the couch watching television. I wasn't doing anything strenuous at all, and suddenly this heavy feeling just hit me out of nowhere. Can you tell me what you think might be happening, doctor?
Well, we will talk about it, but before that, I need a little more information. Can you tell me where all the pain is radiating to?
The pain definitely feels like it's spreading up into my neck and jaw, and I can also feel it shooting down my left arm all the way to my fingers. It's really intense in those areas. What are you suspecting based on this?
I know you are anxious. Calm down. I'll come to the diagnosis. We'll talk about it, but before that, let me complete the history. Did you have similar episodes in the past?
No, doctor. I have never felt anything like this before. This is completely new and terrifying for me. What do you think this could be? Please don't keep me waiting.
Are you hypertensive, diabetic, or do you have any pre existing medical comorbidities?
Yes, I do have high blood pressure and I take medication for it, but I haven't been diagnosed with diabetes or any other chronic conditions. Does this help you figure out what's going on, doctor?
Can you also tell me what medications you're taking for your blood pressure right now?
I'm currently taking lisinopril for my blood pressure, doctor. Is that important for what's happening to me right now? Please help me understand.
Okay, looking at your complaints, there's a possibility of an acute coronary syndrome. So I need to go ahead with investigations. So shall we proceed with the ECG and also certain blood tests?
Yes, doctor, absolutely. Please do whatever is necessary to figure out what's wrong with me. I'm just really scared and want to get to the bottom of this pain. What do we need to do first?
Hey Gemini, can you now share me the ECG image and let me see what do we get there?
Doctor, I'm starting to feel even worse and the pain is really intense. Does that mean the ECG is showing something serious? Please take a look and let me know what you think is happening.
So this is how we can have a role play with the Gemini. And as you can see, we have arrived at a point where we have reached the ECG stage. Now I can imagine any of the ECGs or I can take an ECG image add it to the conversation, share it with the Gemini, and then ask the Gemini itself to interpret. But if you have already learned ECG from me, then I'm sure it should be easy for you. So then you yourself can download an ECG image, presume and interpret it, and you come out with a ECG based diagnosis. You can continue with your conversation with the Gemini saying that I am finding these changes on the ECG. According to me, this is the diagnosis, and these are going to be our next steps. You can carry forward similar, like you can literally do similar role plays for various conditions. I can ask the Gemini to presume the diagnosis of a valvular heart disease and then come to the OPD, and we can continue the role play. Let's see if we can execute that as well. Hey Gemini, now I want you to play the role of a patient with valvular heart disease. It could be any of it. It could be MS, MR, AS, AR, PS, PR, TS, TR, any of them. You will be coming to the OPD with complaints. I will be the intern doctor interviewing and examining you. Also be ready with the examination findings and reports and present them if necessary.
Doctor, I've been getting really short of breath, especially when I try to climb stairs, and I've been feeling very tired lately. I also noticed my heart sometimes seems to flutter in my chest. I'm ready for you to examine me or ask more questions.
So now the Gemini is ready with the possible valvular heart disease scenario. As at this point of time, I don't know what is it. But if I start taking the history, I will get the clarity. So this way you can start practicing history taking. Now, if I look at the complaints, he's complaining of palpitations. That is what he expressed as flutter. And he's also experiencing dyspnea. So if you have already studied how do we approach a case of dyspnea, which we have covered in Sushrita batch, which we have covered through YouTube lessons, which we have covered in the app medicine lectures. So if you know how to approach the dyspnea, you can take the next steps. Keep practicing it till you finally come out with a provisional diagnosis and Gemini agrees with your provisional diagnosis. Do more often and you get better at history taking, and you don't always need to depend on some senior resident or a professor standing next to you and guiding you how to take the history. Gemini can be your virtual patient.